Good morning, everyone. My name is Rosalind Young Daniels, and I'm president and publisher of BlackHealthMatters.com. And I thank you for joining us for this wonderful educational event. As you know, we're doing this program in partnership with Kappa Alpha Psi Fraternity Incorporated. We're delighted to share that all the wonderful information that is being shared today will stay up on this platform for 3 months. So spread the word, let everyone know that if they have a session that they'd like to go back to, that it's here for them to review. Now I have an opportunity, and I am so honored to introduce you to our presenters of the day. They are Rev Al Sharpton and Dr. Dale. You're going to have to help me with your last name.
Okorodudu. Quite phonetic.
Okay.
Okorodudu.
Okay. Okorodudu. All right. Now, Reverend Sharpton, I actually am such a fan that my parents and I snuck backstage of Politics Nation to watch you do your broadcast when you were working with Marquise, when he
Oh,
was one of
yeah.
your associate
Okay.
producers.
All right,
Yeah,
great.
so we're big fans, and it runs deep in our family.
Thank you.
All right, now I'm going to go with the bios. Reverend Al Sharpton is an internationally renowned civil rights leader, founder and president of the National Action Network, and host of MSNBC's Politics Nation. He founded the National Action Network in 1991, which is an organization designed to increase voter education, to provide services to those in poverty, and to support small community businesses. The National Action Network has more than 100 chapters around the country. Dr. Dale Okorodudu is a physician and founder of Diverse Medicine, Inc. and Black Men in White Coats video series. He completed both his programs, his undergraduate and medical training at the University of Missouri, and completed his internal medicine residency training at Duke University Medical Center. Dr. Okorodudu is then completed his pulmonary critical care fellowship at UT Southwestern Medical Center. He is passionate about addressing healthcare disparities and promotes diversity in the medical workforce. There are so many reasons why this important session is being brought to the forefront. It is essential that we have more African American male physicians as a part of the pipeline because they have a special key to unlocking health disparities for our people. Here are a couple quick points. There is a wide disparity in the representation of Black doctors in the medical field. Black Africans represent 13% of the population, and the amount of doctors represent 4%. So there are not enough doctors really to go around. And we know that research, especially a Stanford University study, found that Black men seen by Black physicians were more likely to engage with them and even consent to preventative services like cardiovascular screenings and immunizations. Additionally, the Black doctors were more inclined to write detailed notes about their Black patients. So our Black doctors really hold the key to improving health outcomes. They're a blessing to our community. And I now turn you over to this distinguished panel for a discussion.
Morning. Well, I'll just start by first saying thank you. Thank you all for having me and allowing me to hop on here and just say a few things and chat about the film with Reverend Sharpton, which for me is a huge honor. I've been watching Reverend Sharpton since I was itty bitty on a whole variety of things. So for me, it's a huge honor. And when they said I'd have this opportunity, it just meant a lot to me. But thank you everybody for joining the panel and for hopefully you had a chance to watch the film and to see the video. As mentioned, this is something that's been important to me for quite some time. since the past, a little bit over 10 years now. We've been working on this, trying to get more Black men and Black women. So we call it Black men and white coats, but it's really Black men and Black women, anybody from a marginalized background, working on getting more of them into the field of medicine. So, we started this back about 10 years ago, and just to kind of lay out how all this unfolded with Black men and white coats is initially just started when a report came out from the American Association of Medical Colleges saying the number of Black men applying to the field of medicine was actually decreasing. And when that report
let me stop you there, Dr. Dale, because I think it's important that we understand that the work you're doing is so important. That what was the impetus? What was the thing that made you decide to do something? Because there's always something that in any of our journeys that says something needs to be done, even if you don't know at that moment exactly what that something would manifest it to be. So what was that thing that triggered you? And then why is it so important in this area? Because many of us that deal with civil rights issues, equity, equality, talk about health equity, but you can't really get to health equity and health care equity if we don't have enough of us in the medical profession. So what you're doing, I think, is as necessary as those of us that are fighting on the outside, because we need what you're doing. So I want to know what triggered it, and I want you to tell us why it's important. What you're doing brings up the numbers of Black male doctors or Black female.
Yeah, very good point. Very good point. So it actually goes back even before we started Black Men and White Coats. When I was an undergrad student, University of Missouri, I was flying to my cousin's wedding in Chicago, and I got on the airplane, and it was mid 2000s, and it was wintertime, and I'm wearing these big baggy sweatpants, baggy hoodies, thing, just kind of the way we dressed back then. I got on the airplane, and I sit down by myself, and a middle-aged woman comes to sit down next to me. And for the whole flight from St. Louis to Chicago, about maybe 45 minutes to an hour or so, the whole flight, she's just criticizing me, berating me, talking about, why do you dress like that? You must be a thug. Why do you talk like that? Yo, doggy, you must think you're cool or something. Why do you look like that? And I remember I was studying, I had my chemistry book, and I was studying my chemistry book. And she said, what are you studying? I said, chemistry. She said, are you studying to be a drug dealer? Based on the way I looked. And I'm sitting here thinking, this woman has no idea who I am. I'm a straight A student, just got accepted to medical school just a little bit before that or so. She had no idea who I was, but just criticized me based on the way that I looked. So Reverend Sharpton, that was actually the very first thing that made me say, hey, I need to be more involved in this, because if she's criticizing somebody like me, who's, somebody's out there getting an education, about to go to medical school, imagine all the criticism people who look like me face all day, every day. That was the very first thing. And then with that, just anytime I saw something pop up in healthcare that I thought was wrong as it pertained to increasing diversity in the field, I felt like I had to get engaged.
Wow, that's a great story. Let me ask you, in general, the data shows that whether it's diabetes, whether it's heart condition, all the way across the board, that the Black community is over-indexed in the worst health concerns and health infirmities. How would bringing more Black men, Black women in the medical field, how would that help alleviate the absolute over-index that we are in many areas of infirmity? Because I don't care what we want to be, we can't be anything without our health.
Yeah, exactly. It's quite a few ways, a lot of ways. I won't go into too much detail, but I'll list them. The first one was just mentioned in the introduction. So what we do know from this large study a couple of years ago is that for Black male patients specifically, but you can extrapolate and assume it's the same for Black women, but Black men specifically, the studies show that if you have a Black physician, and a lot of people will quote it as Black male physician. That's not what the study was. The study was Black male and a Black physician, you're more likely to follow the physician's preventative care recommendations. For example, getting flu shots or diabetes screening, things of that sort. So that's the first thing. So patients are more likely to listen if the physician looks like them. The second thing is Black doctors are more likely to go practice in those areas that they might come from, right? So if you want people to go back to the, quote unquote, urban environments, to the Black environments, these communities, I live in Dallas, so to go to the South Dallas, these types of environments, you want individuals who are from those environments. Of course, we know that they're more likely to understand the culture, things of that sort. But on top of that, they're more likely to actually go back there and practice in those areas. You can understand the culture all you want, but if you don't go practice, it doesn't matter. So we know that from earlier studies as well. And something else that people often leave out, which I think is critical, and you go to medical school for 4 years. After medical school, they do these surveys on the med students across the country. What we know is that students at the end of medical school, when you graduate, those students who had more diverse medical school classes, they self-reported that they felt more comfortable taking care of diverse patients afterwards. So oftentimes we forget about just the simple facts that if you're in a diverse class, so if you have more Black people in your class, you're more likely to feel comfortable taking care of Black patients at the end of the day. I think that's one of the most critical ones that we often forget, especially in the world of medical education.
Now, it's interesting because I think that a lot of us just take for granted our doctors and all. I was fortunate when I was born in the 50s. My parents, their primary doctor was a Black doctor, and he brought me in the world. But it was not a lot of Black doctors as I grew up, and the numbers began to increase a little. But then, as you cited, there was a study where there was a decrease at some point, which was disturbing you. Why do you think that the decrease happened, and how do we make sure those that may not necessarily want to be in the medical profession, but that are in the community or in institutions, churches, fraternities, sororities, whatever it is, how do we make sure that we do what we can to set a climate to continue to encourage the increase and avoid the decreases that you cite?
Yeah. So in terms of the decrease, I'll tell you what's fascinating about it. And Dr. Mark Neve, he's the one who figured this out. He was out of the AAMC out in the DC area. He got invited to go talk at Howard about Black men. So he wanted to talk about Black men in health and medicine. So what he did was he went to de-aggregate the data between Black men and Black women, because for years we thought that Black people in general were increasing and going to medical school. But when he de-aggregated that data, he saw, wow, all these years we were deceived. Black women are going up, but Black men were actually going down. So had he not done that, we'd probably still not know to this day. So why is that happening? I think one reason is just for exactly that, is we thought everything was fine, so nobody paid attention to it. So I think that's the first reason. It's just kind of overlooked. We thought it was fine. You don't know what you don't know. The second reason is because nobody paid attention to it, there wasn't the strong enough emphasis to promote it as an option for young Black men. We live in a society, I'm never going to criticize entertainment and sports, things of that sort, but we live in a society where those things are glorified. Educational values aren't glorified quite as much. So these things weren't being promoted, and our young Black boys didn't know it was an option for them. They had no idea it was an option for them. I'm not talking about Bill Cosby the man, that's neither here or there for the point I'm making. But when you think about when I was growing up, we watched the Cosby Show. That was such a big thing for us, right? We watched a different world. You had a fictional role model on TV. Nowadays, kids don't really have that so much. So at least we had things to look at. And then let alone if you don't know anybody in the field of medicine who looks like you, that's not being promoted to you as an option. So I think the first thing is, and this will come to answering your second question here, is we have to find ways to promote the field of medicine as an option to our young Black boys and Black girls. So one of the things, we do is the Black Men and White Coats Youth Summit. We do it in cities across the country. And for us, it's such a great experience because it's not just medical professionals. You got teachers, you got, pastors, you got the whole community comes out to show our little Black boys and Black girls, this is an option for you. So I think that's probably the biggest thing people who aren't in healthcare can do is say, hey, let me show you this thing that's an option for you.
I think that's very important because people tend to gravitate toward what they can see. And if it's not in your reality, you don't even think that is within your reach. And all of us, at whatever levels that we serve or operate in the community, can set that climate, that these are options, that these are the things that are open to you, that are feasible for you. Because a lot of people that engage in our community in street life, feel that's all they can do, and don't see a way out. I don't think anyone is inherently born with wanting to walk around doing things just on a corner. But if that's all the options that they see, there was a comedian when I was a kid, Flip Wilson, say, "What you see is what you get." And I think that the way you laid it out is important, that all of us have to be part of painting the picture of options. Now, once I'm a young man, I'm a young woman, Black, no money, come from a family with no money, in the hood. I hear the options. I hear the people in my community, the community center, the preacher, and Al Sharpton on TV, saying I have the option. Then what can I do? Give me the practical steps that I take. And if I'm somebody encouraging somebody, then where do I send them to get started once they made that, once they made the decision they want to pursue a medical profession?
I'm going to shameless plug right now. I'm going to say blackmenandwhitecoats.org, right? Blackmenandwhitecoats.org. I think a lot of times families or, teachers, parents, they'll think that they have to know everything themselves. And sometimes we might forget that there are people out there doing the work, so you don't have to know everything yourselves, right? There's places with resources. So specifically for those young Black boys and Black girls that want to go into the field of medicine, that's why we built Black Men in White Coats as a place for families and such to get those resources. So you can send on our website and just Google. There's tons of resources. So the first thing is you got to be able to connect people with the primary resource, not a secondary, but a primary resource. That can then link them out with other things. And this ties in with what you're saying. I think this is an important point to make as well. Two important points I'll make briefly. Number one is we have to educate the educators on the topic. So one thing I'm passionate about is making sure parents are well equipped themselves. So we spend time doing things, having sessions specifically to prepare parents. So if their child does decide, hey, I want to be a doctor, the parents then know the next steps. And then the second thing there is the fact that, and I don't have an answer for this, and Rev Sharpton, you'll know much more than I would about this, is no matter how many options you have and you give them the blueprint and such, still, at the end of the day, they still have to have resources. It still costs money to become a doctor. And I could say a million things about it, but at the end of the day, I don't have the answer to overcoming the resource barrier, at least not yet.
No, but I think as we partner, which is why this discussion I think is important, as we begin to partner the community, I think that you given the way and first given the imagery that we need, the symbolism that we need, the example that we need, and then given the steps, then it means that our corporate community must help with the resources, our government officials and all. We need to marry this together. And those of us that are advocates need to advocate on this. This is as much an issue as all of us have to remain healthy and alive. So this is not even some optional issue because we can't do anything without health. And I think we need to really build a circle, a community around this. And I think that is why it is important what you're doing, because all of it, if you don't conceive of it, you will never achieve it. And it starts with putting in the mentality of our community that we can pursue the medical profession, and those that don't, that we are obligated to expose it and make it something that our kids would see as an option. Let me ask you the last question. What has been the most fulfilling and bright moment in your doing this? What if you had to choose, this is the thing that kept me going, this is the thing that really made me feel it was all worthwhile, what would that moment be? And end this last question by giving me another shameless plug for your Black Men in White Coats.
So I won't say it's one thing, but it's one of the same types of things. And that type of thing is every time I see one of our students get accepted to medical school. That's all you need, right? Because these are students who didn't think it was possible for them. These are students who for years, we guide them and they say, I can't do it, I can't do it, I can't do it. And they get that acceptance letter, and that's the happiest you've ever seen them do it. So wow. That medical school acceptance for each one of these students is the one thing that keeps us going, and that's enough. And my shameless plug, blackmenandwhitecoats.org. And, you know, we're a resource for you all, and we're here to help people. We do a lot of things right now. We give out tons of stuff, and, you know, we just do our best to serve the community to the best of our ability.
Well,
And
I
you can follow us on
appreciate
social
this.
media.
I
Sorry,
appreciate this. I think it's very important. I hope people will go to your site. I hope people follow this up. And I'm glad we had this conversation, Dr. Dale. Thank you. God bless you. Stay strong.
thank you, sir. Likewise.